Hi everyone, welcome to this day 4 of the MCQ series on head neck of this 2 MCQs in 5 minutes. I'm Dr. Ankit and let's start this session over here with the first MCQ. So the MCQ says a 23-year-old man was punched in the left eye in a bar fight, which resulted in periorbital edema and ecchymosis. In the emergency, the man refuses to open his eye, and when his eyelids are pried open, he exhibits a vertical diplopia, specifically when asked to look up. A corneal CT reformat image reveals asymmetry in the left orbit and the superior antrum of the maxillary sinus, apparent in the image. What is the most likely cause of the patient's diplopia? Now, if you look at all these findings in this particular question, now he was actually punched right in the left eye, and which led to edema and ecchymosis. Fine. He refused to open the eye, and when the eye was opened, he exhibited a vertical diplopia. Right? Diplopia means seeing two images. Specifically, when asked to look up, he exhibits diplopia. Image is also given. What's the most likely cause? Now you can see the image over here, right? This is a corneal CT image. The options are paralysis of the lateral rectus. Now vertical diplopia and lateral rectus, they don't go hand in hand. Lateral rectus for abduction. Entrapment of the inferior rectus muscle in the left. Now if you look over here, look at the maxillary sinus on the right side, look on the left side, look at this tissue, soft tissue over here, right? So this might be the entrapment of inferior rectus. Now inferior rectus, how is it involved in looking up or in a vertical direction? And when you look up, looking up is the main function of which muscle? It's the main function of superior rectus or inferior oblique, not the inferior rectus. But in elevation, what you need to do is you need to relax the inferior rectus so that the superior rectus and muscles, they can do their job. Now if the inferior rectus is entrapped, as you can see over here, obviously that job will not be done, so this appears the most probable answer. If you look at other option, damage to the infraorbital nerve. Now infraorbital nerve comes out from here through the infraorbital foramen, but it has nothing to do with motor supply to the extraocular muscles. Or paralysis of the superior oblique. Now superior oblique muscle obviously will be present superiorly, and superior oblique muscle has no particular role in looking up. Plus you can't, when in the CT also, the superior oblique position is close to the roof of the orbit, right? So therefore answer is option number B over here, second option, right? Here in this image you can see all the muscles, extraocular muscles. We are looking at a left orbit, right? We are looking on the left orbit. Now look at few of the muscles, look at the superior oblique, which might have confused you, and look at this inferior rectus where it is lying below, right? But below this is also inferior oblique as well. That is also a thing, but the inferior rectus is more anteriorly projected, right? So this is a left orbit. You can see the medial rectus muscle, the lateral rectus muscle, and the other muscles. Fair enough. Let's see the next question. A 8-year-old boy comes to the physician with painless and smooth mass located in the midline of his neck at the level of the hyoid bone, as noted by the arrow in the given photo over here. This palpable midline neck mass was asymptomatic, but due to the recent expansion, it has caused difficulty and pain when swallowing. When he swallows or protrudes his tongue, the mass moves superiorly. Now this is a very important finding. When he swallows or protrudes the tongue, the mass moves superiorly, right? So they are saying that once the patient asks the patient to protrude the tongue out, this mass will elevate. It tells us that there is some linkage of the tongue with the mass over here. Now what is the most likely diagnosis? Enlargement of the deep cervical lymph node. Now this was asymptomatic, so you can rule it out. Thyroid nodule, again, this thyroid nodule could be an answer, but in that, if this nodule is secreting hormones, it won't be asymptomatic, right? Branchial cyst is basically present on the lateral aspect in front of the sternocleidomastoid muscle, and branchial cyst has no relation with the tongue. We are left with the one option, that is the answer, thyroglossal duct cyst. Why so? The reason is, when you look at the development of the thyroid gland develops from this thyroglossal duct because there is a duct, this duct which is coming from the foramen cecum of the tongue. Yes, you got it right. From the tongue, the diverticum arises, goes down, and that in future forms the thyroid gland. Have a look at this image over here. Okay, in this image, you can see this thyroid gland developing from the foramen cecum, the duct coming down from the foramen cecum. And in this diagram, you can see from the foramen cecum, the route by which the duct is migrating down, and finally it forms this thyroid gland, right? So therefore, if you ask the patient over here to protrude the tongue out, then obviously there is pull on the duct, and the cyst which is located over here or around the hyoid bone obviously will try to move up, right? So that was the one thing that was asked in the question. So that's all. I hope you guys are enjoying. That's all. Thank you from my side.